So let's look back at some of the legislative reforms that were already done, and oftentimes legislation is passed to try to undo the reforms they did before, but all they end up doing is making them worse. So the first that we want to talk about is the major reform is the 1943 tax exemption that was given to employer plans, one of the worst things we ever did in this country, 1996 HIPA, 2004 HSA reform, 2010 ACA, my favorite, and 2016 21st Century Cures Act. 1943 tax exemption, why was it the worst thing that ever happened? Because prior to that, people bought their own private health insurance plans. Really wasn't health insurance at all. It was just Blue Cross hospitals decided there was a way to make a little extra money if they didn't fill all their beds by selling discounts to their hospital. If you come to our hospital, you can get a discount. The discount was usually 10, 20% depending on the area. The cost was about 25 cents a month. Those were sold door to door. About how many people had this, quote, health insurance, would you suppose? About 14% of Americans. What did everybody else do? They just paid like they paid for all other services. They paid or they bartered. There were 5 children in my family. We lived in Wichita, Kansas. The doctor would come to take a look at us, and my dad was a car mechanic. And he'd go, all right, Calvin, we need to do this with your family, and hey, I'll give you a call as soon as I need my car worked on. That's how we arranged with our doctor. My mom had 5 children. We had very little money with my dad being a car mechanic. He always worked 2 or 3 jobs. And as such, how did they pay the hospital bill when they had 5 kids? It's because it wasn't very much. They didn't have to file all these health insurance claims, etc. And then we also know that after the law, the tax treatment favored employer plans. Well, that made the employer greater incentive to increase a benefit over salary. Employees became shielded from the true cost of the insurance. Why did I matter? My employer's paying for it, right? I just get this benefit that I hardly ever use. And then, of course, we had unions who got involved because, gee, I hardly ever go to the hospital. This doesn't really help me. You know what would help is if it paid for X or X or X. And so employers were like, well, if that means more to you than a salary increase, we can do that. And Blue Cross became Blue Cross Blue Shield and started including other things within and it became actual insurance instead of discount plans, Living healthy lifestyles was no longer important. Because, gee, my insurance is paying for this, I really don't know how much things cost. And then it was problematic to change plans because now, as this became more and more a part of my life, and I leave this employer and asked to leave this employee, and now I'm going to go to another company, maybe they don't offer health insurance, but that's okay, I'll just go buy a private plan. Oh, that's right, they individually underwrite those private plans like insurance is supposed to be done. Your rate is based upon your potential of claims. Well, wait a minute, that didn't happen in my employer plan. I just filled out the application, I got a policy. My rate's the same as everybody else. That's the problem. So if they were declined by private plans because they had a very high health condition, was that the fault of the private plan or the fault of employer-sponsored health insurance tax treatment? Let's look at HIPAA. Most people think of HIPAA as privacy, right? I need to get this filled out or have somebody in there. Actually, in the insurance world, of course, it's COBRA. Because, gee, we can't have this happening. Remember, government's trying to fix things. We can't have this happen that people are going out here and leaving their group plan and can't get a private plan. Let's talk about how many people that is, by the way. If you listen to the Democrats, and sorry if there are any Democrats in this room, but I doubt that there are. If you listen to the Democrats, nobody could get a policy. No one. I mean, if you had acne, you couldn't get a policy, so says Nancy Pelosi. Well, the truth of it is that under AHIP, we know that nationwide, 87% of the people who applied for a policy got one. There must have been tons of people in these high-risk pools, right? Because nobody could buy a plan. They would all be turned down. We'll talk about that in just a minute. ACA was built on so many falsehoods, but let's go back to COBRA. So COBRA was designed to, quote, fix this problem of people leaving a group plan, couldn't get a private policy, maybe it took a while to get another job. So let's require continuation of coverage. So, Mr. Employer, if you have somebody on your plan, you have to allow them to stay on. They pay for it themselves for at least 18 months, in some cases 36. This created employee rate shock. Remember, they didn't know how much it was. They go on COBRA and go, I've had people actually call me, Beverly, I know that you talk to legislators all the time. Have them do something about COBRA. It's just way too expensive. That's just a cost of your insurance. You're just seeing the actual cost of it now. The healthier often sought the private market because much, much lower rates in the private market, right? And then short-term medical plans came in. The other thing that was required as part of HIPAA was that every state guarantee a policy to everyone. Did the Democrats tell people that? Where's the media about, well, every state already required that people be allowed to have a policy. Now, of course, that just didn't fit into their agenda, so you never heard that. But they said things like this. If you get sick, that insurance carrier will raise your rates through the roof in the private plans. They act like private plans was some wasteland out in the jungles. And also, oh gosh, they will drop you. I mean, the minute you get sick. Well, first of all, HIPAA forbid it. In 1996, it was completely forbidden, could not happen, but we saw all kinds of media reports giving that for Pinocchios, right? Wrong. How many Republicans stood up and said, wait, that's not true? Nobody. Everybody believed it, including Republicans. So how did states handle this, everybody's guaranteed to have a policy? Here's what they did. They said most states set up a guaranteed plan, usually through Blue Cross, and said, well, if you wait till you apply because you have some large claim coming up or some very expensive pre-existing condition, then if that happens, we do have these plans set aside for you, a guaranteed policy. Some states said, well, here's how we're going to do it. We're going to give you more choices. 35 states set up what is called a high-risk pool. If you listen to Democrats, that's a dirty word. You actually said the word high-risk pool. Oh, my gosh. Well, here's how high-risk pools happened. High-risk pools then were the guarantee. They usually had 3 or 4 plans that they offered. The premiums in those plans were capped at about 150% of the traditional policies. And they didn't require a mandate that everybody has to buy health insurance. Instead, it just said, you can buy it if you want, but if you decide to wait till you get sick, you will pay more. What happens if you decide you get sick to buy life insurance? What happens if you decide that you're going to you have a wreck before you buy auto insurance or have a fire before you buy? But if you listen to the Democrats, that's mean. Oh, it's not these people's fault. But yet, there was no mandate required. It was funded by carrier premium tax, not taxpayers. It wasn't state dollars. In fact, in my state in Kansas, about how many people do you suppose were in the high-risk pool? Well, if you listen to the Democrats, hundreds of thousands. Well, how about 1,200? That's it. The premium tax was more than enough to help fund the high-risk pool, fund the entire insurance department, and had plenty of money left over to go into the general fund. We taxpayers didn't have to come up with that. We didn't need federal dollars to help people pay for their health insurance. It also said that underwriting was allowed to continue in all those states. Some states did have age banding. No offense to our legislator sitting here, I'm sure she doesn't do this, but a lot of times legislators sit around thinking about how they can gouge insurance companies and doctors because they're all mean. So they said, well, you can't make the seniors pay more than 5 times what a younger person has to pay. That's way too much. Well, in our state, we said, look, you have to compete with each other. You decide how you want your age bands to be. You want it 20-to-1? That's entirely up to you, but you've got to sell your products to people, and it has to be something that they want and that's affordable, so we left it up to them. In states that had fewer regulations, and these 35 states did, most of them had very good, very inexpensive plans. Lower premiums. In my state, you could buy a child's policy, and that's, if you look at our Forbes article, Linda and I have a chart in there about Kansas and Colorado. You could buy a child's policy for $28 in 2009. Back when the Democrats told you, oh, these private plans are terrible, $28 to put a child on a policy. My son, when he was 30-something, his premium, $48 at the time. Under ACA, it was over $200. Now it's over $300, which is why I put him into a health care sharing ministry plan. They had no subsidies. No subsidies were needed. But there were 6 states that said, this is how we're going to handle that guarantee requirement of HIPAA. We're not going to let insurance be insurance anymore. It's just going to be prepaid health care and no underwriting allowed. Can't even ask health questions. And hey, 19-year-olds should be the same price as 64-year-olds. And no matter where you live, it should be the same price. And no matter whether you use tobacco, same price. So everybody's rates was the same price. How many 19-year-olds were willing to pay $500, which is what it was, for a policy in New York, for example? Full community rating is what that means. Extensive state regulations. Lobbyists knock on the door and legislators say, okay. I think my service should be free under a health insurance plan. All right, done. Well, and they stand up and go like, you're welcome, everybody. That was my bill. I got that passed for you. They might as well say, you're welcome, everybody. I just raised your insurance rates. You can thank me later. Highest rates in the nation in those states, sometimes 3-4 times of everybody else. And of course, how do you have such expensive rates and not do something about it? So they had to do something, so they passed all these state subsidies, Healthy New York, et cetera. Let's get to the 2004 HSA reform. Finally, a reform that was a good thing. It was triple tax advantaged accounts, encouraged consumer behaviors, incentivized transparency. Look, when you go to a higher deductible, and by the way, most people, if given the opportunity to choose their own private plan, choose a higher deductible because they would rather take their chances. Do you know 75% of Americans never spend more than $500 a year on health care? Did you know half of them spend nothing? I can be in a room and say, how many of you didn't see a doctor at all this year? Almost half the room will raise their hand. That's because most Americans don't even know where their health insurance card is. I think it's in my wallet. Who's your health insurance carrier? I don't know. Do you know what your copay is for a doctor's visit? 25 sound right? I don't know. Last time, though, I got a prescription like $4. This is most of America. So when they're saying we're going to help people, 87% of people in 5 different surveys said they were satisfied with their health insurance before the ACA. Did that stop the Democrats? No, they just took this approach. We know you all love your plan, and we know you're all satisfied with that, and you like your doctor. Not a problem. We're not going to upset that. In fact, what we're going to do is we're just going to help these poor saps over here, and you never heard of it, but it's this private market, and trust me, it's awful. And we're going to try to help those people over there, but you can keep what you have, but it's going to be good. I always say it's like this when they talk about replace. I said to Donald Trump's team when I met with them in the White House recently, how many people in Donald Trump's rallies or any Republican rally was out there yelling, repeal and replace? Nobody. But they were yelling, repeal this mess, get rid of this. But Democrats were yelling, what are you going to replace it with? So all the Republican legislators were thinking about is, what are we going to replace it with? So then we have carriers offering pricing tools. I remember when Aetna invited me to Baltimore, Maryland and said, hey, I know you helped pioneer HSAs, you're going to love what we're doing. People now are asking us, how much do things cost? I have a $3,500 deductible. My daughter needs a tonsillectomy. One of the pieces I wrote for USA Today is, how much is a tonsillectomy? And they said, here's what we did. If you have a policy with Aetna, you can go in there, put in tonsillectomy, and list all these doctors and how much their charges are in the hospital and how much their charges are, and shop around, decide where you want to go. In time, with HSAs becoming more and more popular, nearly every carrier, I don't know a carrier that doesn't offer that, but people just don't know what's available. It's a cost-sharing tool. Of course, these HSAs grew exponentially. Devener tells us, and this was their 2016 survey, 20 million people now have an HSA, and they hold close to $37 billion. What I want to know is, why don't we see the American Banking Association coming up there and saying we need to expand HSAs? Because they don't want to look like the guys that are just trying to rake in dough. This is when I was invited to the White House. I'll show you this quickly because I'm back there in the corner if you can find me. Notice that Karl Rove was at the head of the table, and he goes, Beverly, you can't see around Robert Hurley, the man who created eHealth Insurance. I helped put this group of people together. And he said, so why don't you scoot over here? Well, this is the official photo of that day, and it looks like I'm at the head of the table, which is hilarious. This is the 2010 ACA. I'm not going to spend a lot of time in here, but I'm just going to tell you what I shared with legislators recently on the Hill. And that is, when you say you're going to do partial community rating, 3-to-1 band, when you say guaranteed issue, you can't ask any health questions, when you say essential health benefits, we get to decide what has to be in all plans, and we say dependents can't have to be on the plan up to age 26. Did you know this? Did you know many states already had age 28? Florida had age 30. but they're going to demand it like they did something great to age 26. In my state, if you were 26 years old, you could have gotten a policy for $45. Stay on your parents' plan, it was probably close to $200, which is a better idea. And then medical loss ratio, were all kinds of regulations put on insurance companies that all they did was force all the small carriers to either sell or get out and just left the big carriers. So let's go back to those 6 states again. Wait a second. Aren't we laboratories in the states? Didn't they already do this stuff? Yes, they did. Didn't we already know what to expect? Of course they did. Of course those architects, Jonathan Gruber and all of the rest of them, they knew exactly what they were doing, and they knew the rates would go through the roof, and they knew exactly what would happen because it already happened in those 6 states. So they had to mitigate this. So the way they mitigated it was, look, all the sick people are going to sign up, and the healthy people are going to not take insurance, so we got to mandate everybody buy it. What good's a mandate without a fine? And wait, we can't mandate people to buy stuff they can't afford, so we better do subsidies. And how do we get subsidies to the carriers unless we do an exchange? And how are we going to police this unless we get the IRS involved in Homeland Security? And we need to verify people qualify. And then we need to do Medicaid expansion for those people that didn't fit into that category. The next question is, how are we going to pay for all this? Oh, no problem. We'll do 28 new taxes. We'll lower the doctor reimbursement. They won't care. And we'll eliminate dish funds eventually. We'll slowly eliminate those. But I want to go back to, what is Obamacare? It's those top 5 things. It's those top insurance regulations. You've heard the Democrats say, oh, come on, you Republicans have tried to repeal Obamacare 52 times. Can you name, I know all those bills, can you name a bill that included repealing these regulations? No, not one. The recent Senate bill, both of them, the recent House bill, how many of those regulations were gone in those bills? None. That is Obamacare. None of the bills are repealing it. You know why? Because they say we can't get it through reconciliation because it's not affected by the budget. This is the cost driver. How could it not be part of the budget? What were the results in the marketplace? Well, you know them all. Private rates went up. My son's policy, as I told you, went from $50 to $300. Group rates, especially for healthy groups, went from 20% to 50% because they weren't allowed to ask health questions anymore. And they just had to assume everybody was unhealthy. Carriers left the market. Subsidies not enough to get people back down to the rates they already had before. More and more people were put on Medicaid that didn't even know their kids qualified for it. I met with people every day in tears. I didn't even know my kids qualified for Medicaid. We've been able to pay for their health insurance, but we can't now, so I guess we have to put them on Medicaid. In fact, the studies that were done, I, thank God, have pushed the wolf away from the door. I and others in our state of Kansas, we have not expanded Medicaid. Thank you, God. However, thank you. God bless Sam Brownback, our governor. But the reason we were able to do that, this is what astounded me. The people who were proponents would bring in all these people in wheelchairs. And I would say, well, this is not the population. This is the population that will be hurt with Medicaid expansion because they will have longer waiting periods to try to find a doctor that takes Medicaid because you put all these able-bodied people onto a program that was designed for them. Last thing on this page, 11 months waiting period. I had a young man call me in February from Wichita, Kansas, and he said, I need help. I quit a job or lost a job, and then I thought I would just get another job with insurance. I haven't had any luck finding that. Now I find out that I have this tumor, and I'm going to need a $50,000 surgery, and the hospital won't take me unless I can prove I have insurance. Can you please get me insurance? I had to say, were you recently married? Did you lose that job within 60 days? No. Recently have a divorce? Recently have a baby? Recently move out of your coverage area? Then I'm sorry, young man. There is no insurance policy available to you because nobody can sell it to you. You have to wait until open enrollment, that 6-week period, November 1st to December 15th, and your policy will not go effect until January 1. Hear about this all the time in the news, don't you? Isn't this totally covered by the media constantly? Nobody talks about this. How was it before? That young man would have come to me and I'd say, you know, you made a mistake by not buying a policy right away. That's okay. You will have to pay more, but I'll help you fill out an application. Your policy will start March 1st, and you will be in the high-risk pool, and they will take you, which is more humane. The 21st Century Cures Act. That act, really the only good thing about it, which wasn't a good thing at all, was QSE HRA. If you know about HRAs, this was to help small employers. Qualified Small Employer, HRA is what it stood for. And I said, why are we doing this? Please don't do this. Instead, pass HSA reform to allow employees to pay for individuals whose employers don't offer group health insurance to pay for their premium out of their HSA to equalize the tax treatment that was done. And let's take away the requirement that is you have to have a particular health insurance plan to have an HSA, and just let every adult have an HSA. And then we equalize the tax plan. It's portable. Employers can get out of the insurance business that they hate being in anyway, and they can just put money into an HSA, still get the tax deduction, and they are done. And do you know what I was told? Well, we've had a lot of lobbyists come up here and tell us HRAs are better. Well, who were the lobbyists? Look at that bottom tier down there. Administrative fees to TPAs. Third-party administrators wanted to clean up by saying, hey, we'll come and help you, and you can give us a lot of money, and we'll help you set up an HRA, a health reimbursement arrangement. But you have to meet certain criteria and certain requirements and confusion over the impact, et cetera. Guess how many employers have actually done that? Maybe a handful at best. So now let's get to what actual legislative reforms can we unleash on a consumer-driven revolution. Well, first of all, ladies and gentlemen, we can repeal the ACA. Why is it we don't just say, we're going to pass a full repeal bill, and let's just let these legislators raise their hand and say, I vote no on what they've been promising America for 7 years. But you know what they do instead? Well, Beverly, we just don't have enough votes. Well, isn't that nice that these people who won't vote yes get to hide behind and go, could they go back to their constituents? I would have voted yes. I wanted to repeal it, but you know, we just didn't have enough votes. Instead, what do? They came down to a skinny bill. Rand Paul is saying, can we just at least do this? Can we just say we're going to get rid of the 2 mandates? And we're just going to get rid of the Medicare device tax. Can we at least agree on that? And John McCain said, nope. We can't even at least do that? Give me a break. Susan Collins, you've heard a lot about her. Why isn't Maine in favor of repealing Obamacare? Because, ladies and gentlemen, if it was repealed tomorrow, would any of their state regulations change? No. Do they still have Obamacare? They still have all those same. Why would they care if it was repealed? They still had all those same regulations. I'll tell you why. Remember I told you their state had to subsidize? Now guess who's subsidizing their poor regulations? We are. So now the federal government's giving them tax credits and subsidies and Medicaid expansion money. They don't want to go back to what they had before where their poor regulations were causing them to subsidize. They want the federal government to continue to do it. But they're going to say it's because we care about America and we want to protect them. Look, I have a hashtag on that I use all the time, and if you want to use it, if you do Twitter, it says hashtag Feds repeal, states replace. If there's something wrong in your state with your private market, then fix it. Let's not have a one-size-fits-nobody plan from the federal government and get that done. Expand HSAs. There's a wonderful bill called Flake Brat. No matter what you think about Jeff Flake, at least this is a good bill. At least the Republicans are trying to fold that bill, and it does exactly what I talked about. Allows premiums to be paid to equalize the tax treatment, including healthcare sharing ministry fees and direct doctor fees. It enlarges contribution limits. It eliminates all the plan requirements, or at least expand those to where it can repeal the ACA and HSA restrictions as well. By the way, thank you, but no thanks to Rand Paul on what he's trying to do with association plans. In a nutshell, they just become high-risk pools, and it just eventually dries up and goes away. Because who joins an association plan? Unhealthy older people who hope somebody else will join that will help them lower their premium. The somebody else who joins goes, I'm sorry, it's how much? Yeah, no thanks. And eventually they fold up and die. Please don't buy across state lines, dear God. Buy across state lines will do nothing except put the federal government over states, over state insurance regulations. We're trying to get rid of that. Look, if my daughter who lives in New York City goes online and wants to buy a policy in Kansas, is she going to get those rates? No. Is she going to get those providers that it was based upon? Nope, because she's in New York City and everybody's going to be out of network. If you were to buy car insurance today, go on Google and go to any car insurance website, and what's the first thing they ask you? What's your zip code? Because based on zip code changes what your rates are, whether they offer policies in your area. A new company came to Kansas coming in 2018 called Centene, and they are going to offer policies in Johnson and Wyandotte County only in Kansas. What if somebody in Missouri wants to buy that plan? Centene never agreed to sell policies in Missouri. They haven't priced them that way. They knew they can be competitive in Johnson and Wyandotte counties. We're going to force that carrier to offer policies over here and figure out how to price them. Buy across state lines is something that should have gone away a long time ago. What changes can employers make to promote a consumer-driven health plan? If you know any employers who offer policies, they can at least change to an HSA and seed the HSA. They can increase their deductible and add an HRA component with an HSA after the deductible. They can make a very large plan that just can't go over the $65,000 component of the HSA. If you have under 50, drop your group plan. And finally, bring someone in to talk to your employees about sharing programs. Bring someone in from the local clinics to talk about the low-cost care that people can get from your organization. Speak out against the ACA. For heaven's sakes, people, I loved what was said here. Don't give up. We can't give up. We can't roll over and say, well, thank you, John McCain. I guess we can't repeal Obamacare, but thanks for trying. I'm a member of the Tea Party. We need the Tea Party to rise again. We need people clamoring and calling their legislators. So individuals can go to a direct pay doctor. I've supported that since my friend Rob Stalen back in 2005 set up cashdoctor.com. Demand HSA legislation. Vote our legislators out who don't keep their promise. What changes can doctors make? There's something you can do. You can join the AAPS if you're not a member. You can lobby against the ACA and government bureaucracy. Why don't doctors stand up? Do you know who we hear from in Washington, D.C.? American Medical Association, because they represent all of you guys, right? Well, America thinks they do. And unless you guys are up there going, they do not represent us, that is wrong, this has hurt our patients, we need to get this repealed, and you need to do it, and you need to keep your promise, or we are pulling any money we've ever donated to you. Call your legislators, tell your story of what's happened to your patients. They need stories. Demand HSA expansion and full repeal of the ACA. Educate your patients on how to get involved. Educate your patients. Say things like, well, I could have helped you with this before, but thanks to the ACA. And be transparent with your own pricing. And it's been a pleasure to be with you, and I look forward to your questions.